President of the Intensive Care Society, and here in studio by Dr. Paddy Mallon, who is an infectious diseases consultant at St Vincent's University Hospital and Professor of Microbial Diseases at the UCD School of Medicine. Paddy, if we could turn to you first, a big rise in cases today. Are you seeing that in St Vincent's?
I think right across the country, talking to colleagues earlier on this evening, that we've seen a change in the last 24 hours in terms of clinical presentations at hospitals. We've been expecting it, but I know our experience in the last 24 to 36 hours at St Vincent's Hospital is that we've seen sicker people coming in. We've seen a higher proportion of people coming in that are being diagnosed with COVID, and we're starting to see people not only unfortunately passing away from this illness, but also ending up in our intensive care unit. So this is a surge that has started. Talking to colleagues around the country, they're having similar experiences in hospitals around the country. So this isn't something that we're now waiting on, this is something that's now actually happening.
But what about that point that was raised in Richard's report about the seemingly high number of healthcare workers that have been infected so far? What are you doing, what can you do to protect them?
My impression from the high numbers of healthcare workers is that probably the majority of those may not be becoming infected during the course of their working duties, which I think is encouraging. I think that there is probably a preference towards testing healthcare workers who are at risk, for example, those that are returning from places overseas where there's high numbers of cases, because we want to make sure if someone has symptoms and they've returned and they're in healthcare that we know that they're the COVID negative. So I don't think that we're at the point in the general healthcare system that we're seeing a spread of this infection in the hospitals, and I think that's important for your listeners to know. However, we have had several instances around the country, namely in Cork and Limerick, where we have had instances of large numbers of healthcare workers having to go off on a containment or quarantine leave because of either having contracted the virus or having been in contact with it. So it's an issue that we take very seriously, and it's an issue that we continue to be extremely vigilant about.
Okay, Catherine in Limerick, thanks indeed for joining us. Richard was mentioning in his report there the lack of, perhaps the lack of enough intensive care beds. How well provided are we in comparison to other European countries?
We're roughly at about half the European norm, and we have half the beds that Italy would have.
Okay, and
This has been a well-documented situation.
And how much of a problem is that likely to be in the weeks ahead?
A significant problem, which is why we need people to take this seriously. This is a virus. We know it's near us. We know it's in every county in Ireland. We know that if we don't control the surge, we will have a major problem coping. There is seriously no healthcare service that could cope with what Italy have just gone through, or indeed Wuhan and China. So we have a limited amount of beds, and we have been working very hard for the last number of weeks to try and increase the capacity. So the HSE have funded a significant number of beds, and we've all identified places in our hospitals where we will treat and ventilate patients. But ideally, you don't need to get to see me. You need not to get this disease, and you need to do that by keeping away from other people. 2 meters away, stay in your own home, wash your hands. Prevention in this instance is the best cure, and that is what the people of China have taught us, and that's what people in South Korea have taught us, that's what Singapore has taught us. Once you come to the ICU, 1 in 5 patients in my intensive care unit lose their lives. And I don't know the death rate from this disease yet because it is new. You don't need to get on a ventilator with this, you need not to get it. You need to make sure, if you're young, that you don't give it to your parents or your grandparents. That is really important. And the only way to do that is to actually, for the entire community, to actually really think about this, keep away from each other. Essentially, we must treat each other like pariahs. That's what we have to do, all of us. It's a real change for us, but we need to do that to prevent what has happened in Italy happening here.
And